Well, there are over 100 different types of arthritis. The disease can strike anyone at any age, and right now, over 4.6 million Canadians have arthritis, and this number is expected to skyrocket as our population ages. So to tell us a bit more about arthritis and a public talk this weekend is Dr. Marvin Fritzler. Good morning, Dr. Fritzler.
Good morning, Leah.
Thank you so much for being here. One of the areas you're talking about, of course, is arthritis. And, of course, arthritis is so common and affects so many people and so many different types of it. But you're looking at it specifically in terms of personalized medicine or something you call precision health.
Yes.
What does that mean?
Well, precision health has two main features to it. Number one, an early diagnosis so that we can do a better job of prevention. The main challenge today is once a patient is diagnosed and you sort out the 100 different kinds and what the individual has, then it is almost too late to make significant advances. So you're starting to treat already joints that have significant damage. So we want to move way back to early onset and develop new approaches to making early diagnosis and then early treatment. For example,
how does that work? Yeah.
If you fall on the ski hill and injure a shoulder or a knee or something, the question is, what is the appropriate treatment? We used to, say, well, you'll eventually get over it. Well, people like me didn't get over it eventually. We eventually developed significant problems. But we now know that there are early interventions that will probably make a difference to the long-term outcome. So it's early treatment, number one, then personalized health comes to the right patient, the right drug, at the right time and the right dose. That's the challenge we have now.
That sounds a bit challenging, yeah, like a little bit hard to do. So how important is it in terms of research in this area to really make this happen?
Well, the McCaig Institute at the Cummings School of Medicine is probably one of the leaders in trying to achieve all the things we've just talked about. We have probably the most advanced imaging of bone and joints in North America, if not the world. We also have leading technology in terms of blood tests that can be done that predict disease and then actually give the physician a better idea of what's the right treatment for this kind of arthritis. Then we have the most advanced approaches to prevention of joint injury and disease. So we have sort of a full suite of investigation and research, and beyond that, the treatment modalities that are changing in step with that.
Oh, that's cool. So if you, let's say you are a patient, and well, let's go with your
I am.
Yeah, me too.
I've gone from doctor to patient, actually.
That's probably good. It informs your practice, right?
Does.
So what happens if you do fall on the ski hill, and you do have this injury? What can a patient do right now to sort of advocate for themselves when it comes to this idea?
Well, right now, the best approach is, of course, to see a physician, because you need to know exactly what is the damage that's occurred, and then taking that to the next step, what should be the next approach. We used to think, you would treat the pain and that's all you really needed. But we now know that there's a whole sequence of molecular events that are triggered when you injure a joint that probably you can cut down the damage right at the point of contact, or the point of when the injury occurred.
And do you do that by talking to your doctor and saying, listen, I really want to get on top of this, I don't want this to become a problem down the road?
Well, we're at the cusp of the leading edge of what we're changing in our approach to treatment, so to get doctors involved now is the next big challenge. That's a big part of what the Wood Forum is about, so the public knows where things are going and what's going to be available. So the approaches are changing in real time today, and it's sometimes difficult to keep up.
For sure it is, which is why we have the Wood Forum. You brought it up. So this is a talk that's happening this weekend. It's at the TELUS Spark Center. It goes from 10 a.m. until noon. The great part of it, it's tickets and parking are both free. Dr. Fritzler will also be speaking there along with a number of his colleagues. So head out to that if you're looking for some more information about arthritis and you. Thank you so much for being here this morning.
Thank you, Leah.